Hello everyone, and welcome back to my video series on cognitive behavioral therapy. This video today will be talking about adapting CBT for younger populations. So cognitive behavioral therapy is a highly adaptable and effective therapy for children and adolescents. However, young clients differ from adults in their cognitive, emotional, and social development, requiring a modified approach. So you may be asking, why adapt CBT for younger generations? The cognitive development. Young clients have limited abstract thinking skills and may struggle with introspection. The emotional expression. They often express distress behaviorally rather than verbally. An engagement need. Games, stories, and interactive activities make therapy more effective. And there's also family involvement. Parents and caregivers play a huge critical role in reinforcing CBT strategies at home. So, as we adapt for the younger populations, CBT for children and adolescents follow the same core principles as adult CBT, but is just adjusted to match developmental levels. So, for example, young children for ages 4 to 7, you use a more play-based therapy such as puppets, storytelling, drawing, and you want to keep interventions simple and concrete. You teach emotions with visual aids such as emotions, faces, feeling charts, where with ages 8 to 12 in the middle childhood, you can introduce basic cognitive research reconstruction, so where you replace negative thoughts with positive ones. You can use metaphors and stories, like thoughts as detectives to investigate those negative thinkings. And you can encourage behavior experiments, so testing new ways of coping. Next, we have adolescents in ages 13 to 18, where you might adjust to have used Socratic questioning and journaling for cognitive restructuring. You want to focus on peer-related stressors, such as social anxiety, academic pressure. And you can also integrate technology, where they have CBT apps, text and mood logs. Some common issues addressed with children and common issues addressed with CBT in children, because it is so widely used to treat a range of mental health. It can be used in youth. And some of the most common are anxiety disorder, such as school anxiety with fear of tests, peer rejection, or performance exceptions. We have generalized anxiety, separation anxiety, social anxiety. There's depression, the low moods, low self-esteem, negative self-image, suicidal ideation. There's behavioral problems, so we have acting out, defiance, school refusal, aggression. There's also trauma and PTSD, some from bullying, abuse, loss. Also, obsessive compulsive disorder. There's also phobias, which could be fear of animals, heights, public speaking. Or a big one is ADHD related issues with impulsivity and emotional regulation difficulties. So, for example, a 7-year-old with separation anxiety might benefit from gradual exposure techniques to school drop-offs, or a 14-year-old with social anxiety may need cognitive restructuring to challenge negative thoughts about social rejection. CBT is effective because it provides concrete coping skills tailored to each issue. To keep children and adolescents engaged, therapists use creative, interactive methods that make therapy fun and relatable. So, for example, we have cognitive restructuring. We can do this through storytelling, where we use relatable characters to illustrate thought patterns. We have visual thought records with drawing or drawing emotions. We have the gamified exposure, where we use role-playing and reward-based system. So some effective engagement techniques also could be, for younger children, the play-based interventions with the puppet therapies to act out emotions. Like I said, the storytelling with positive coping messages, or the drawing exercises to express thoughts. Also, we could use the metaphors and visual aids. So, for example, the worry monster to externalize anxiety, or the thought detective to help challenge and fight against and investigate the irrational thoughts. Or we have something such as the emotional thermometer, where you can scale distress levels. Next, we can move on to the journaling and thought records for teens. So this is where we could do the daily mood tracking, the gratitude journals, the CBT worksheets. Also for the technology integration, the CBT apps for thought logging, videos and animations explaining the CBT concepts, and online chat-based check-ins. So for example, a way you could do one of these could be a child is afraid of dogs, so you could start with pictures, then you can observe them they can observe them from a distance and gradually approach them from with a friendly dog. The techniques help translate CPT principles into engaging age-appropriate activities that keep children motivated and involved. So with that example of the dog, so with the child, you have them look at the picture, and then once they get comfortable with the picture and then observe a dog from a distance, depending on the age, if you want it, you could give them a reward, things like that. So you just kind of tailor it specifically for the child's age. Obviously don't do anything that's too complex, don't do anything too baby for like teenagers and things like that. So it's kind of the same with any client. You always want to make sure you engage your client, you check in with them, you kind of just look and make sure that if they're engaging, if they're having, second like thoughts where you think that they may not be doing well with the technique, you want to make it approachable and age appropriate for the child. Also, with adapting CBT for children, the role of parents and caregivers is critical. So, unlike adult therapy, CBT for children requires strong parental involvement to reinforce these skills at home. So, how can these caregivers and parents support CBT? They can do this by modeling healthy coping skills, so parents can demonstrate problem solving and relaxation techniques. They can reinforce CBT strategies by encouraging children to use coping techniques in real life. They can provide positive reinforcement through rewarding progress, such as praise, sticker charts. They can create a supportive environment to reduce stressors and promote emotional expression. So, for example, a parent helping a child with anxiety at home can practice deep breathing before bedtime. Some parents receive direct training in behavioral management strategy, especially for children with ADHD, so this can help with impulsivity and emotional regulation, anxiety disorders, so gradual exposure and practice at home, or oppositional behaviors, so using positive reinforcement instead of punishment. So, for example, a child with OCD may practice exposure therapy exercises with parent support. Or a teen with social anxiety may have a parent help with gradual exposure to social settings. Parental involvement significantly improves treatment success by reinforcing CBT skills outside of therapy. However, there are some challenges and consideration in CBT with youth. So while CBT is highly effective for children and adolescents, it does come with challenges. Children often have short attention spans. Young children may struggle with long discussions requiring brief, interactive activities. Limited insight. Some adolescents may resist self-reflection, requiring gentle questioning and encouragement. There's also some parental resistance. Some caregivers may not understand CBT techniques requiring psychoeducation and comorbidity issues. Many children have overlapping conditions such as ADHD and anxiety, needing a more flexible approach. To overcome these challenges, therapists must be creative, patient, and adaptable in their approach and for each of their clients. So to conclude, CBT is a highly effective and adaptable therapy for young clients, equipping them with lifelong coping skills. CBT must be adapted, to the developmental stage, such as play for kids and structured dialogue for teens, and some common issues treated include anxiety, depression, and behavior problems. Engagement techniques like games, storytelling, and tech tools enhance the therapy for teens and children, and parents play a crucial role in reinforcing CBT strategies at home. And by tailoring CBT for younger generations and populations, we help children and teens build resilience, manage emotions, and develop healthy thinking patterns that will benefit them into adulthood. Thank you, and thank you for tuning in.